Healthcare should be free for the citizens of the United States with the help of the government to make this free. Free healthcare would provide maximum protection for the citizens, obviously, against risk because they wouldn't need to invest into this healthcare in order to ensure that they can afford to live, basically, especially when there is a medical emergency that is life-threatening. For free healthcare, the citizens wouldn't have to pay for important medical emergencies, things like prescriptions in the instance, let's say, that you just need it once because it's an illness that you never get or something like that. Prescriptions shouldn't be hundreds of dollars, but they should be an affordable price. I know I've picked up prescriptions for like $5 or $10 with my insurance. That's how much prescriptions should cost when healthcare is free for the citizens. Visits to hospitals for childbirth and medical emergencies, let's say an older person falls and hits their head, things like that should be covered by our government. You shouldn't need to have insurance when it is basically a natural thing that happens in life. Shouldn't cost you tons of money. The government should help, obviously, especially with reproduction and childbirth. That shouldn't be such an expensive process when it's something that almost everybody goes through. It should be free, and the government should obviously be supporting that if they want to have more economies in the future. Other things that should be free include things like gynecologist appointments that also relates to childbirth and things like that. Anything relating to like cardiovascular health and things like that should be free. If it's a surgery, I guess it shouldn't be free unless it's a life-saving surgery. If it's a surgery you need for something like a broken bone or like a broken finger, those might need a cost because they don't happen to everybody and they aren't necessarily life-threatening. But the cost doesn't need to be thousands of dollars. Either way, with free healthcare, things like this, the prices will also decrease because the government will help cover medical expenses if, important things are free. So, not to say that a broken bone isn't as important as something else, but let's say somebody is suffering from a heart attack, obviously, to revive them or help them recover from that should be covered by the government versus having to pay thousands of dollars. And especially for those who can't afford insurance, it is important that the government helps us out with medical aspects because that involves literally saving the lives of citizens. The poverty levels in the United States increase as the medical insurance and care prices also increase. When people can't afford medical care but they're put into a life-threatening situation, let's say some sort of accident, and they need to pay thousands of bills to recover from this, then they're obviously going to be put into the poverty level range of income in the United States. Healthcare does put tons of Americans into this poverty level because healthcare is something that everybody needs access to, but not everybody has access to. And without being able to afford this insurance, many people are spending thousands of dollars and putting themselves into debt because they don't have help from their government in order to afford their medical needs. When the government helps citizens with healthcare, it is good for economic productivity. When people have access to free healthcare, they are living healthier lives and they are contributing more to the economy. What I mean by this is that when people are sick, obviously they can't show up to work, and some people are so sick and can't afford their health care, that they might just have to fall into unemployment or quit their jobs because of this, when the problem is they need this job to afford the health care. If the government was helping and funding health care and making it free for all citizens, then these people would be able to get back to work after a week or two, or they wouldn't have to stress about missing work because they can afford the remedy or recovery that they need for whatever they have fallen ill to. So let's say somebody gets COVID, we're just going to put this into recent times, somebody gets COVID and happens to affect their lungs more than it affects somebody else. If they can't pay for that surgery and they're not allowed to go to work, how are they expected to survive that situation? When people have COVID in these days, you're not allowed to go to work. They specifically, I know at my job, they make you scan a QR code and check off symptoms. If you have any of these symptoms, go home. Like, don't show up to work that day. And if somebody, is susceptible to having fatal injuries from COVID or anything like that, then obviously they're not going to be able to return to work. If the government had free health care in relation to life-threatening injuries like this, then maybe this person could get back to work. I guess one step closer in relation to COVID is that the government was offering free COVID tests, so at least you would be able to confirm if you had it or not. I know when I got tested for mono about 2 years ago, I had to pay a $25 copay, but that's with my insurance. So for someone who doesn't have insurance, a test for viruses might be hundreds of dollars for them. And some people can't even afford to get tested, which is the problem, because then these people fall sick and they didn't even know they were sick, which could have been prevented if they had enough money to go get a test. Many nations do offer free health care. Some of these nations are the United Kingdom, Norway, the Netherlands, Canada, Denmark, Germany, Switzerland. All offer free health care in one way or another, and the quality of life goes up for these countries and nations. So number one, right now you can see Canada has the highest quality of life, and that's because their government provides free health care when it comes to situations like childbirth, emergency room visits, regular physician's visits, because these people are able to receive the care they need and not have to stress about how much it's going to cost. And then sometimes when people stress about the cost, it makes them end up avoiding going to the doctor at all. So free healthcare would benefit our country and our economy a lot more.